key things that we do is not only advocate about quality health care, teenage pregnancy reduction and prevention programs in our community, but we also take it very seriously about our individual health as Latina leaders. It's oftentimes we forget to take care of ourselves, and we don't want that to happen. So what HOPE did a couple of years ago is that through the support of the California Endowment, and thank you very much, California Endowment, and all those that represent the endowment, we were able to start a social media campaign which we titled Hope Ag Health. And if you go onto our HOPE website, www.latinas.org, you'll be able to download some videos talking about the Affordable Care Act, as well as some videos that we have in a partnership with one of our local regional great Latina organizations, Latina Coalition of Silicon Valley, about individual videos of Latinas and what they're doing to make themselves healthy. So with that, we thought it would be fantastic to bring to you a panel of experts that really are going to touch upon how to build a healthy community from a variety of different perspectives. And in doing that, we went to one of our clear friends in this effort, in one of the original sponsors of the Hope Leadership Institute, and that was Kaiser Permanente. And they have been very supportive of Latina Action Day, and they said, absolutely, we want to step up to the plate and support this panel discussion because it's aligned with our vision and our goals for our community. So thank you very much, Kaiser, for sponsoring this panel. And then we took it a step further, and I said, who in the community is an expert when it comes to healthcare, when it comes to building healthy communities? Who's worked in government representing a variety of different types of governors, from Governor Schwarzenegger, working with our past First Lady Maria Shriver, and who right now is a leader in the California Endowment and can really guide us, if you will, through this discussion. And I'm very happy to say a dear friend of HOPE, Daniel Sangali, stepped up to the plate. So without further ado, I would like to turn the program over to Daniel Sangali, our fantastic moderator. He had the vision to make this more talk show style and much more interactive. So there will be a fantastic opportunity for you not only to hear great information, but also contribute to the discussion. Daniel.
Guys, thanks for sticking around. So first I just want to say that we from the California Endowment are honored to be here again this year and have a role in this important day and program. At least a couple of my colleagues are here. I saw Aide Gonzalez is here and Marlon Cuellar. You guys wave so everybody knows who you are. If you guys want to ask for a grant for money from the endowment, talk to them, not to me. Okay, so yes, as Helen was saying, you can see we changed the set a little bit up here. We have these comfortable chairs because this is going to be a conversation that you guys are going to be involved in, a little different than the panel before. And we're going to get started in a minute. But just briefly, the idea for this conversation is around building healthy communities, because a lot of us who have been working in the health field for some time came to realize at some point in our careers that if you're concerned about people's health, you have to be concerned beyond the doctor's office, beyond the hospital, beyond the traditional ways people think about health, because many of those disparities that we discover, the health outcome disparities between Latinos versus Anglos, for example, come back to neighborhoods, come back to the conditions where we live, not just access to health care in the traditional sense, but health actually happens in our neighborhoods and our schools. And so to kick us off, we're going to show a very short, I think it's 30-second ad which the endowment just produced to get this message out there that health happens beyond the traditional way we think about it.
Let's make health happen here. Let's make health happen here.
Conversation about how to build healthy communities. We're going to start. I hope you guys all know about the work of Western Center on Law and Poverty. They are any of us who've worked in government know them as the champions for underserved communities. They always show up. They always have their act together. And they always have a very principled approach to every policy issue. And Vanessa Cajina is one of those leaders, a real star of Western Center, and I believe a graduate of the Hope Institute.
07!
07. So Vanessa's going to kick us off with a couple visuals to show, and then we'll get the conversation rolling.
Thank you so much to Daniel, and thank you so much to Hope for the opportunity to present here today. As Daniel said, I'm a 2007 graduate of the class of the Hope Leadership Institute. Couldn't be prouder to be here. Helen and Carrie have seen me through a lot of changes in my career, and I couldn't be prouder to be sitting here in front of you today. So, by a little bit of background, when I started in health policy, this is even before I really knew that community health was a thing, and I was lucky to be in a position in my home where I was surrounded by people who were ensconced in the concept of public health. But it didn't really get me going until I was about 20 years old, when I went to a presentation by a guy by the name of Dick Jackson, who for a short amount of time was the public health officer of the state of California. And he was really the first evangelist to talk about where we live and how it affects our health. And he did this amazing presentation on the structure of public health and what it means for healthy communities. So from then on, I was very involved in the concept of having healthy foods around you, having options and choices, being able to live in places that we choose to live that are a healthy place for us to raise our families. So for Latinas, I think building healthy communities is going to be a big challenge over the next few years because of the places where we live and because of the options that are afforded to us for the most part, by and large. So when I think about living in a healthy community, there are three big questions that I ask myself. Do you and your family have health care that you can afford that meets your health needs? Can you afford enough food to eat to feed yourself and your family? And are you comfortable seeking assistance from the state if you need it? A lot of us don't, and a lot of us will not, and we need to change that. So the Western Center on Law and Poverty has been in existence since the late 1960s. We were founded as part of the War on Poverty, and we concentrate on access to affordable, quality health care, on access to public benefits like CalWORKs and food stamps, otherwise known as CalFresh in California, and also on safe, affordable housing. So in terms of Latinos, we don't really access programs in the ways that we're eligible for, and I think a lot of that comes from stigma and a lot of that comes from pride. There's a lot of pride. I don't want to accept that kind of assistance in my home. I'll make it on my own. It's there if you need it, ladies. It's there if your neighbors need it. It's there if your families need it. So if we're talking about the numbers of uninsured Latinos and Latinas in Medi-Cal right now, of the eligible but unenrolled number, we are by and far eligible but not enrolled in Medi-Cal, which provides quality, comprehensive, affordable health care for low-income people in California. Healthy families were also underrepresented in the number of eligible but uninsured. And there's also overwhelming evidence to tell us that there's underutilization of CalWORKs, which is our state cash assistance and welfare to work program, and CalFresh, which is our food stamp program, and which is also the single biggest thing to alleviate hunger in the state of California, and the school lunch program, even though we're represented in all those eligible populations. So in terms of what we need to do there, we need to reduce the barriers to what it takes to get those programs. We need to eliminate the stigma that exists around public assistance. We need to provide more and better options for people to go when they're looking for those choices. And we need to increase opportunity for people. So here's how we can do this. I'm a structuralist by nature, and I think it's important to advocate to the state of California to tell them what is important to us. So there are actually 4 bills going through the legislature this year that Western Center is supporting and or sponsoring that will increase options, increase opportunities, reduce stigma, and reduce barriers. So in terms of increasing options, AB 1640 by Assemblywoman Holly Mitchell would allow pregnant women to become eligible for CalWORKs as soon as they can prove that they are pregnant, also eligible for the full range of Medi-Cal. So this would really help women get firm grounding under their feet if they're pregnant for the first time, if they don't have kids in the home, and they need some help. CalWORKs is not a program you go onto because it's a lot of fun to be on. It's a program you go onto because you need it. 80% of the women represented in CalWORKs are victims of domestic violence and are trying to make their lives better. Bills that increase opportunities. So in CalWORKs, you have to be able to work to show that you're qualifying for that assistance for the most part. There are some family-only cases, but AB 1691 by Assemblywoman Bonnie Lowenthal would allow CalWORKs recipients to count ESL classes towards their welfare to work requirement. Considering that there are a lot of families that are working to better themselves and get into better careers in the future, we think that's an important goal. To reduce stigma, one of my other jobs was I was a cashier at a supermarket, and I would occasionally police people in terms of what they were buying with their WIC coupons. So, oh, I'm sorry, this coupon is good for regular Cheerios, but not Honey Nut Cheerios. And I'm sorry, you're going to have to take those back, says the 20-year-old cashier to a 30-year-old woman with 2 children with her. That's a really ugly place to be. So SB 1190 by Senator Ronnie Hancock would replace those paper coupons with an EBT card that we currently use for the CalWorks program and for the CalFresh program. So we think that's a bill that takes away the stigma of what it says to be in a checkout line at a supermarket. And then lastly, in terms of reducing barriers, applying for public programs is also not a fun thing to do, to go into a welfare office and to say, well, I need health care, but I don't know if I'm eligible for CalWorks, or maybe I need food on the table in a day, but I don't know that I'm eligible for health care. SB 970 by Senator Kevin De Leon would require sort of an integration of public programs across the spectrum as a result of the Affordable Care Act, so that people can give permission to apply in one place with one set of information across the board. So, like I said, we're structuralists at Western Center. We want to reduce barriers, decrease stigma, and increase opportunities. And with that, we think that we can increase healthy communities for Latinas. Thank you.
So one quick question before we move down the panel. Obviously, I'm really interested in the issue of reducing stigma. And I know one of the victories for many people in this room in the past year was the removal of fingerprint imaging for food stamps, now known as CalFresh, right? How important was that?
That was a big deal. To be able to take people out of a system where you're saying, if you need to put food on the table for your family, but you need to come in like you're getting checked for a DUI and to give your fingerprint, was a huge deal. You know, for a single mother to go in and have to provide that kind of identification, just to say that if you're using food stamps in Alameda County, that you wouldn't be duplicating in Contra Costa County. It takes away the concept that somebody is a criminal because they're seeking assistance for their family.
Terrific, thank you. Okay, next we're going to move to Kim Belshea. I still want to call her Madam Secretary because we work together. Kim has been Secretary of Health and a Director.
And I always insisted that you did.
I wasn't aware that she had her own microphone. Okay. For those of you who don't know Kim, she's pretty awesome. For not being a Latina, she's pretty awesome, I'll tell you that. And she's now on the Exchange Board. You've heard a lot about the California Health Exchange Board that's implementing the Obamacare, Affordable Care Act. Kim's one of those board members. She's served 2 governors of 2 different parties and served with distinction, and now a senior fellow at the PPIC. Does that sound right? Okay. Kim?
Great, thank you. Well, it's great to be back here again. I had the good fortune of spending time with you a year ago talking about the very early initial phases of our state's implementation of health reform. And, you know, as we think about what has transpired over the course of the past year and all the drama in Washington with the courts and the campaigns and so on, you know, we're really fortunate to be in a state where our elected officials have said reform matters. Reform has an opportunity to improve the health of individuals, of families, of communities. And we're moving ahead, and I am delighted that the Health Benefit Exchange is a key piece of California's efforts to connect millions of Californians, individuals and families, to coverage, to promote improved access to prevention and wellness services, and to contribute to this effort to build healthy communities. So Vanessa talked about, you know, the 3 questions she asked, the first one of which is really focusing on, do you have access? Do families have access to affordable coverage that meets their needs? That is a big part of what California's Health Benefit Exchange is all about. So what is the exchange, other than a very jargony term that with the good efforts of Josefina and Ogilvy and others, we're going to come up with a different way to brand and talk about this thing called the Health Benefit Exchange. But an exchange really is about consumer empowerment. It's about choice. It's about healthy competition. The idea is kind of like a Travelocity or Orbitz in terms of an online marketplace that's really customer friendly. Or like Groupon in terms of harnessing the power of a lot of people purchasing together to get a better deal. So California's elected officials said, you know, an exchange, a purchasing pool, can really help individuals and small businesses have the same kind of purchasing clout as big businesses. So you get more affordable products, you get more choice, you get higher quality. They also understood an exchange can really bring people together and force health plans to compete on delivering better health at a lower cost, as opposed to competing by trying to segment, you know, I'm going to avoid this unhealthy person or try to sign up that healthy person. So what we call healthy competition. And finally, an exchange is the one place people can go to bring a tax credit for those families that have incomes that are above Medi-Cal, so they're ineligible for Medi-Cal, up to 400% of poverty. So this is like between $32,000 and $92,000 for a family of 4. You're eligible for a tax credit. And that can help facilitate your access to affordable quality coverage and meet the new requirements of the Affordable Care Act. So that's what the exchange is about. A marketplace that really provides purchasing clout, choice, and affordable quality products to millions of Californians. The context for our work is the uninsured. That's what we're focusing on principally, but not exclusively. We care about those who are in the individual market, small businesses for whom access to affordable quality products may be hard. The exchange also wants to promote their access to better quality products and more affordable products. So that's who we're focusing on. That's an important context for our work. And diversity is also an important context for our work. The people who are uninsured, as you can see in this graph, are overwhelmingly people from communities of color, principally Latinos. And indeed, roughly 61% of the people who are uninsured in our state are Latino. When we look at those who are estimated to enroll in the exchange using those tax credits I talked about, roughly half of our enrollees, we estimate, will be people from the Latino community. And so that's why we put at the forefront consumers in everything we do, and do so in a way that must acknowledge the diverse cultural, linguistic, as well as economic and educational needs that they will have. We have a vision that is about improving wellness. It's about improving health of all Californians, which recognizes the exchange is an important piece in this multifaceted puzzle that makes up our efforts to improve access to coverage, to services, to improve health as individuals and as broader communities. Our mission is, as I said, to create this marketplace that is about empowering individuals, giving them information, giving them resources, decision tools, and assistance to choose plans and providers that reflects their needs, their values. Now that mission statement is really important because it acknowledges that we believe we should be measured not only based upon our contribution to expanding coverage, but also our contribution to improving quality, affordability, and reducing health disparities. So we're going to probably get into some of these issues in the context of our conversation, but let me just touch on quickly what I would call it as some of the critical opportunities the exchange has to really influence, shape, and improve health and wellness at an individual level, a family level, a community level. Vanessa talked about issues of stigma, issues of pride, issues of barriers to enrollment for services for which people are eligible. Exchange has a really important role to play in terms of modernizing how we approach eligibility and enrollment, and really harnessing the power of technology and community resources to connect people to the resources they need. And we want to do that as an exchange in concert with community that really understand the cultural and linguistic needs and circumstances of the people who are eligible. Opportunity to expand coverage and improve access to comprehensive services with a particular emphasis on prevention, early intervention, and wellness, and ensuring access to those essential community providers that underserved populations rely upon today, and we believe will continue to rely upon appropriately come 2014. Benefit design. You know, we need to structure benefits, in my mind, in a way that really creates more incentives for people to participate in their own health and wellness, and that knocks down barriers to proven strategies that we know improve outcomes, particularly for people with chronic disease. Health plans. We're going to make some important decisions in terms of what health plans are offered as choices. Here's a great opportunity for the exchange to say, these are California goals, California priorities around quality improvement, around delivery system reform, around prevention. So for example, requiring plans to meet certain very specific standards around cultural and linguistic competency. And finally, I'll close on where we began at in terms of the overarching theme of this conference, which is about community wellness. Even though the exchange is about insurance and about coverage and access to services, about the physician's office, if you will, I think we have an opportunity, indeed an obligation, to find ways to use our influence in the marketplace, to use our purchasing clout, to create incentives for health plans and providers to reach out to and partner with community providers that are such an important part of our efforts to create healthy communities. The physician's office is critical, but so much of health occurs in the community. And I think through our purchasing power, we can create some standards, some goals that really help bridge that divide between the physician's office and community health, and in so doing, improve the health of individuals, families, and the broader California community. And that is something we all need to care about regardless, and work on regardless of what happens with the courts, regardless of what happens with Congress. And I'm confident we're going to talk a little bit about that. So I'll close there. Thank you.
So I wanted to ask Kim quickly, our experience is informed in terms of wanting to enroll the most people who are eligible possible on January 1, 2014. At Western Center, we like to call this just press play. Everybody goes into Health Reform on 2014, January 1. Yet we are informed by the Healthy Families ramp-up process. What it meant to really do affected eligibility and outreach and in targeting those communities. I know that we are working with Ogilvy and Heath & Associates to put together a comprehensive outreach campaign, but wondering what you as an exchange board member see as being the most effective ways to target us and our messengers in the community.
One of our, when health reform was passed just over 2 years ago, in 2010, we said, 2014 is tomorrow. We were very mindful of how much work had to be done. The good news is 2014 wasn't tomorrow. Healthy Families was enacted in September of 1997 and opened its doors a short 9 months later. It was remarkable. And it was the first time we really tried to integrate Medi-Cal and this new thing called Healthy Families. And while we learned a lot through a diversity of outreach and enrollment processes, we know what to repeat and build upon, and we know what not to repeat. The good news is we have a little bit of time. And in my mind, as an exchange board member, one of the priorities I bring to our work over the course of the next 18 to 20 months is to do everything we can to identify those populations today who we know will become eligible for either expanded Medi-Cal coverage come 2014, because remember, Medi-Cal is going to be expanded to 138% of poverty, regardless of your categorical stature. You don't any longer have to have a dependent child, for example. It's an income-based threshold, totally simplifying the program. So who do we know are going to be eligible for the Medi-Cal expansion? Who do we know will be eligible for tax credits through the exchange? We know, for example, that people who are enrolled in the Family PAC program, likely many of them will become eligible for Medi-Cal expansion or the exchange. People in breast and cervical cancer screening programs. So there are a whole variety of programs, including our county initiatives. Have people heard about what's called the Low-Income Health Plan? This is a program that many, if not all of our counties will ultimately have. It's going to serve about 500,000 low-income single adults. Incredibly important that we move those people seamlessly into coverage so that come day one, on January 1 of 2014, we're not opening our doors for the first time and saying come one, come all, but we're going to have roughly maybe 1 million people already enrolled. That is only going to happen through work with our legislature and for work with all of you and all the diverse community leaders that interact with people who are uninsured, who know people who are uninsured, who represent trusted sources of information, providers. It's really going to take a partnership. It's going to take capacity. We didn't have the time with Healthy Families that we have now, but it's now our responsibility, and we will have financial resources to support a multifaceted outreach and education campaign that needs to endure over time.
Thank you, Kim, and thank you again for stepping up for that voluntary job on the Exchange Board of implementing the Affordable Care Act. So next to join the conversation will be Irene Chavez, Senior Vice President from Kaiser Permanente. I'm sure everyone here and everyone in California is aware of the role that Kaiser plays as really a model of healthcare delivery, and in many ways the vanguard of preventive healthcare and connection to community care. Irene herself has been a dedicated advocate for patients and for young people in particular. We're very pleased to have you join the conversation.
Thank you very much. It's a pleasure to be here. Recently relocated from Texas and now proudly a Californian. So I was also delighted to join Kaiser Permanente, which I studied all the way back to the late 60s, 70s, and 80s, and to know that it's in the fabric of Kaiser's values and beliefs to be all oriented to making their communities healthier and to make sure that prevention is at the core of everything that we do. So I'm going to give you some examples of some of that work that has actually taken place. Maybe not.
The other way.
The other way? There we go. So, we're going to talk a little bit about what have we done in the community. We have, first of all, placed our physician in charge of the system at San Jose to be an advisor to the communities putting prevention to work, which is to eliminate tobacco as a choice for kids and to address obesity before it becomes a reality for them as adults. At the Children's Discovery Museum, you can see how colorful we've made it. We collaborated with the Hope Kids Cafe, the Santa Clara County Public Health Department, and collaboration is a key to the future success of improving communities. What we did here was to make the choices for the kids simple. So by making it colorful and pleasing to the eye, vegetables and fruits became a choice. And by having the water more prominently displayed than the sugary sodas, that became a preference for the kids, which was the plan. Rethink Your Drink was also a collaboration that was done with Santa Clara County Health Department, as well as a number of other entities. And it won't play because we don't have internet access, but I want you to know that if you go to the Santa Clara County Health website or you come to our website, you can click on the public service announcement. And Dexter is the guy who's drinking the sugary drink. And Martina is the one who is real cool, telling him about water is a better choice and getting him to understand the difference between the two and converting him at the end of the conversation. Very cute, very direct message. The San Jose Jazz Fest isn't just fun from the standpoint of listening to incredible music, but it also carries the message of Kaiser's prevention. We had the health van there, and we talked about mammograms and why they're important. And because I'm talking to an audience of about 99.9% women, we are much better at mammography and pap smears than our husbands or significant others are at prostate or colon cancer screenings, right? They would rather set themselves on fire than go for that kind of an exam. So we have to find a way cleverly, just as we have to make sure everybody in the family votes, we have to get them to that health prevention and to have them understand why early detection is so important. We have a pretty robust school strategy. HEAL, which is healthy eating, active living, drink water, exercise, eat fruits and vegetables. First of all, the first thing that we've learned is to keep the message simple and to make sure that it connects the dots for people as to why is it valuable to me. And so we have initiatives that reach out to the kids and initiatives that reach out to abuelitas and abuelitos and everything in between. And what we have found is that the kids are great advocates for health and keeping grandma on her toes and not eating the heavy fattening foods when she's diabetic. And they listen to that message, and if you can put it in context for them that is simple for them to understand, they'll anchor it and they'll share it with the family. We also know that the generation of the future, much of which is before me, was born with an iPad or an iPod or an i-something in their hand. Feels like they come out of the womb that way now. And this is where they want their health. They don't want to walk or go to an office. They don't want to have to schedule. They want everything in the palm of their hand. So our direction in the future is to have their health record here. If they're diabetics, they can trace their glucose levels. If they're hypertensive, they can check their level of blood pressure routinely. They can tag on, ooh, something's not looking good. What did I eat? Why is that not good for me? All in the palm of their hand. And connect the family in that type of an event.
Thank you, Irene. So the message I'm getting is the kids bring the technology, they keep the grandparents on their toes. The women get us to go get our exams and make us vote, and the men just stay out of the way.
That's right.
That's a working model. Sonia Ramos is president of Latina Coalition Silicon Valley, and I think also a graduate of the Hope Institute, yes?
Yes, 2009. Thank you, everybody. Pleasure to be here and in front of many of my Hope Sisters and this wonderful organization that's done so much for many of our communities across the state. And I'm here to talk to you today about a wonderful opportunity that we have through a partnership with Hope, a grant that we were funded by the Knight Foundation in partnership with Hope and the Latina Coalition of Silicon Valley, which I currently serve as president. And we were able to embark on this, what we were just talking about right now, is this effort and this focus on social media and how to increase engagement of Latinas specifically around social media and using those social media tools for the purposes of community and civic engagement. And so we began our adventure back in September with hope to launch this campaign, the social media campaign, with the overall purpose of identifying a community issue that our community in the Silicon Valley, the women that are representing our community through Latina Coalition and in general, the issue that they would like to embark upon, utilizing the training that they received in September through Hope and the social media training that was offered on Facebook, Twitter, all of the new technology that's out there, and specifically the Power Map tool that was also developed and has been utilized by Hope to help us identify our relationships and power dynamics in terms of those that would be able to help us influence this particular issue in our community that we felt we wanted to make sure we spent time focusing on. And we embarked upon this, ultimately, this campaign called A Nuestra Salud, Hoy y Mañana, to our health today and tomorrow. And so this project was identified by women in our membership and in our community, of a wide range of women from college-age Latinas to women who have been in our community for years, been a part of the organization for many years, who are activists and leading various efforts in our community as well. And so we embarked upon this particular effort to focus on health. And it first started off as a focus on food justice, and then we've, after some discussions, started to work out some of the details, and within the time frame that we had available to us, we were able to focus on and wanted to make sure that we were bringing attention in our community around healthy eating and healthy food options. So in embarking upon this particular health issue, this was a concern for many of the women that we work with, and many of the women in our community, because as you know, as Latinos, many of us have had our own personal experiences with family members who suffer from various diseases, diabetes, obesity, and looking at some of the statistics here in Santa Clara County, we definitely were able to reiterate that picture of the need to focus on a healthier community engagement opportunity. And so with that, we were able to identify the two strategies that we ended up implementing for this particular project. First, we were focusing on community advocacy, so we wanted to give this make this opportunity available to our members and those that were involved with this project to really utilize their talents and their knowledge and experience and advocate for this issue in our community. And one of the ways that we did that was through a reintroduction of a resolution that had originally been introduced to the City Council in San Jose and was unsuccessful, called the HEAL Resolution, which is something that was already mentioned, the Healthy Eating, Active Living. And this is a City League statewide effort by the state of California and the League of Cities to really encourage cities to take on these various resolutions to embark upon and begin implementing policies that will change the way their city looks in terms of access to various parks and outdoor spaces, biking paths and walking paths, really encouraging a healthy environment. And also with regards to the environment, how cities and businesses work together to promote healthy living in their community. And so this particular resolution was unsuccessful, and we felt that as a group we wanted to take on this resolution and begin to reintroduce it and refine the resolution so that it would be something that was a little more realistic in terms of what was we were able to accomplish within the city, and knowing that the city of San Jose specifically has been doing a lot of wonderful work already in making those options available. And so we focused on the city, on the social media campaign as well, to promote individual action through a community of learning and shared focus on increasing education and access to healthier food and healthier eating options. we were able to, I'm going to wrap up, I'm so sorry, this is, 5 minutes goes by very quickly. So we were able to provide social media training to 90 Latinas. We have co-sponsored some healthy forums, and ultimately, if you are able to visit our Facebook page, facebook.com, A Nuestra Salud, this is where we are engaging with our women in our community who are really the focus of this campaign, being that the women and Latinas in our families, in our community, are those women who are preparing foods on a daily basis, taking care of their family, making those decisions, those healthier decisions, and allowing this forum to take place in this community to be created, to share how women in our community are working towards healthier living on a day-to-day basis. And so we hope that you can visit our page and take a look. We have wonderful videos that we invited many of our members to produce, and they're sharing all kinds of recipes and tips and tricks and healthy eating options and things they do on a day-to-day basis in a very real and down-to-earth kind of way. So I will close by inviting you to visit our Facebook page. Thank you.
Sonia, thank you for your presentation. Everyone in healthcare has a passion for what they do, and yours shows. We all believe that we have a mission in connecting with people and making a difference in their lives. So if you have to identify one huge accomplishment, an early win in your program with the social media, what is that one thing that you can say, I'm delighted with the results of this?
Thank you for that question. I think we have been very successful in engaging the women in our community to make decisions and to really rethink the choices that they make on a day-to-day basis with their families. We hear all of these stories of women and the things that they do, the things that they've learned from other women who've been sharing their own personal stories and experiences about how they live and try to live a healthier life. So really the sharing has been really a great win for us.
Thank you, Sonia. Okay, so now I'm going to bring the microphone out to you guys, bring you into this conversation. Before I do that, I'm going to ask the panel what I think is a really hard question. And that is just, here we are, 5 of us from very different sectors, talking about some clearly wonderful things that we're all doing. And yet, the outcomes, the health outcomes in this state, particularly for underserved communities, are not what we know they should be. And there are wide gaps depending on ethnicity, on gender, on other things, and on neighborhood. The variation in lifespan in this state can vary up to 20 years depending on where you live. What is it that we are doing wrong, the 5 of us and the organizations and the good people we work with? Or what can we do differently or suggest to the next generation of leaders that they do differently than all these many good things we're doing?
I'll start from the healthcare coverage side, because while health happens in schools, health happens in communities, in the work site, health also happens in the context of your access to medical care. So while having that insurance card is not the be-all and end-all in terms of determining access to services and health outcomes, it has a very significant effect and is a key piece of our collective efforts and aspirations to improve outcomes for the people of California and not just reduce, eliminate health disparities. So that's part of our job with the exchange. We are that gateway. We will be the place to which millions of Californians will go to either enroll in Medi-Cal or use tax credits to enroll in the exchange, or even if you're not eligible for a tax credit to connect to coverage through the exchange. As I noted, we anticipate the overwhelming majority of the people who will become newly eligible as a result of the expansions in the Affordable Care Act are communities of color. And so I think it doesn't end with coverage, but it begins with coverage. And when you look at the research, the evidence shows people who do not have insurance or people who are underinsured have less access to services, they have poor outcomes, there are greater disparities. And those, by and large, are communities of color as well as some geographic disparities. So I view, and our board views, one of our fundamental goals, our responsibilities, is to contribute to the effort to close disparities in health and healthcare. And coverage is a piece of that, not to the exclusion of community health, but it is a piece of it.
Other thoughts from the panel?
Because I'm the eternal optimist, I'm going to first talk about what we've done well and then some opportunities. Having a significantly large database, we're able to look at evidence-based outcomes, and it was Kaiser who looked at over 400,000 records to determine that the medications for ADHD really didn't contribute to seizures to the degrees that people thought, and that they were safe. And that for a woman who was pregnant, who was concerned about taking an ACE inhibitor, that it did not impact the birth of that fetus and the child would be born healthy. So data is an important component to establishing safe delivery of medicine. I think the opportunities are in leveraging media, leveraging schools, leveraging churches to all carry the message that we have, first and foremost, the responsibility for our own health. And if we don't know enough about it, I'm a diabetic and I really don't know what that means, is to then have access to those places that will give me the knowledge, but there is no miracle, passing of the hands or take the secret pill. The responsibility is each and every person's, and leveraging that through the media and leveraging it through schools and churches, there is a key that will unlock that aha moment for each person, and that's what we need to strive for.
Just in terms of the community engagement work that we were doing, I think that it really became evident that with the conversations that we were having with various folks in the community and health organizations, health-focused organizations that we are not necessarily do not consider ourselves as a Latino coalition and just general community members, we really felt that there was the voice of the Latino community member that we really wanted to feel needed to be elevated in our community, amongst the policymakers, amongst the people making those decisions about what happens in our communities. It really was evident that that was not at the level that we, I think, would like to see it. And so I think that the engagement of the Latino community and the voice of Latinos at the table with those decision makers is really an important piece.
So in terms of what we can do better, we didn't get here overnight. When my father immigrated to the United States in 1943, he was looking at a golden state in terms of healthcare, education, transportation, infrastructure throughout the state of California. And we have year by year, particularly in 1979, 1980, decreased our tax base in terms of being able to pay for what the people of California need. We need to fund it. We need to get the governor's tax proposal on the ballot. I'm going to say West Center supports it. And vote yes on it in May. Because we can have a health benefits exchange. We can have a Medicaid expansion, but we have to have the money for it. And I'm sorry, it is a myth to say that we want all of these wonderful things, but that we're not going to be able to pay for it. I've been working in Sacramento for 7, 8 years now. I don't know what a normal budget cycle looks like. I've been working with 2 hands tied behind my back for 7 years now, and I can't wait for normal again. So that's what we have to do. We've got to fund it.
Great answers. How about a question from you guys? How about a question from Fresno? Anybody from Fresno in the house? Where's Fresno? So are you waving because you're from Fresno, or are you waving because you have a question? Come on, somebody from Fresno? You got a question? Come on, how about San Jose? Any question from San Jose? Oh, here's a Fresno question. Okay, I'm coming after San Jose next.
My name is Monica Blanco Everett. I'm with the Latino Coalition for Healthy California, and I'm representing not only Sacramento, but also my hometown of Fresno County. I want to make sure I thank Kim Boucher for bringing the exchange meeting to Fresno, which was a first for community-based organizations to be at the table and talk to. And while it was a long meeting, it was very well worth it. Afterwards, the conversation was more engaging because people were raising questions that had not been raised before. So I invite you back to Fresno and communities like Fresno because the people do want to know the information. They just don't know how, okay? Especially people of color, and for me, the Latino population is the critical piece. I have a question, and the question is, since we're talking about disparities and reducing them, what are the steps being taken to assure cultural and linguistically competent workforce? In part, much of our positions that we have out there now are at the age of retirement. I'm not quite there yet. I'm hoping to eventually be there. But if I continue to work in nonprofits, I may not ever get there. So my question to you all as a panelist is, how can we be able to assure that the new workforce, number one, that's being trained, hopefully enough to cover the retirement level that we're going to be experiencing in the next couple of years, will be culturally and linguistically competent? Because I've worked in the arena of healthcare, and I see what they use as far as what they call competent interpreters. I speak Spanish, but I don't speak medical Spanish or terminology, so I couldn't tell you what appendicitis was in Spanish. It would not work.
Irene, can you tell us what's Kaiser doing about that?
I'd be happy to. First of all, Kaiser has a school for allied health, specifically for radiology and some of those positions, so we're growing our own per se. And usually, probably 99% of the time, when they come out of those programs, there is a job waiting for them. We are fortunate at this current time that we have very few vacancies in the nursing arena, which across the United States is in dire straits, but not here. Now, 2017, 2018, different picture, because that workforce will be turning. They'll be retiring. So our plan is 2 years prior to that date to make sure that we hire what we call baby nurses and have them go through an ambassador program with the seasoned nurses for that 2-year period of time. So by the time they're ready to be at the bedside, they're safe, they're competent, and they're great at what they're going to do. There is also the concern about shortages in physicians, specifically in primary care for the future, which is why the future of technology, of having your healthcare here, is so important. Because if there are only X number of physicians and you can't gain the access, then you have virtual access. Virtual access, telemedicine is already a reality, and it's functional and it's purposeful and it serves the community in a marvelous way. So if there's mobility problems, if there's transportation problems, we solve it that way. So workforce of the future for us, we're investing now so that by 2017 and thereafter, as they come off, we're prepared and ready to take care of them.
Another question, please. Okay, over here. Tell us who you are and where you're from, please.
Hi, Francis Palacios, Hope Affiliate, on behalf of TrueLatina.com. We're from the Contra Costa area, and I was chatting with somebody yesterday who's a wellness coach, and she says, well, you need 3 servings of fruit a day, times 7, that's 21 servings, and I've got a family of 5. She said, do you have that in your refrigerator? I said, absolutely, but we know a lot of people don't. Fruit is very expensive, vegetables are very expensive. I think if there was some way to subsidize that, I think we'd all be healthier. Just a comment.
Anybody want to talk about that real quick?
Yes. The access to fruit and vegetables with the WIC card, and if you're thinking of making it electronic, it's much easier and much more user-friendly. And we have the access to community gardens that we need to continue to encourage. We helped seed and plant one at Ocala Middle School not that long ago, about 2 months or so ago. And the kids there are looking forward to growing their own vegetables. So regardless of what the problems are, if you get enough people in the room, you can find the solutions.
If I could offer a perspective as well on that question, I think one of the opportunities the exchange has is, as I noted earlier, is to really kind of modernize and simplify and streamline how people connect to services for which they're eligible. Our principal focus is on Medi-Cal and tax credits through the exchange, through health coverage. But we also have an opportunity, I think, to really help facilitate access to other services for which people are eligible. It makes no sense for families to fill out multiple applications answering very similar, if not identical questions, time and time and time again. So for example, a family, the questions you have to answer, we anticipate for Medi-Cal and the exchange, are basically identical with a few differences for what a family would have to answer to become eligible for CalFresh. So here's a terrific opportunity to streamline these application processes. Ideally, maybe have one application, but at a minimum, be able to signal someone, say, you know, it looks like your family may be eligible for CalFresh. Would you like to answer 6 more questions? Or may I refer your application to the people who can finalize eligibility? That's something we refer to as, in jargon, as horizontal integration. But the point here is, we have a responsibility to help facilitate the connection of people to the services for which they're eligible, not only on the health side, but also on the human services side. And I think that is an important contribution we can make to improving wellness more broadly, beyond health.
Okay, I have a question from San Diego.
Hi, good afternoon. My name is Rafaela, and I'm with Planned Parenthood in San Diego. My question is, what would happen if the Supreme Court strikes down the Affordable Care Act?
Any or all of it?
Any and all of it.
So I think that there are a few things at play here. And the first, so there were essentially 5 arguments going on when we were listening to the Supreme Court arguments. And I think the 2 biggest pieces of this that were well, actually, no, I'm going to talk about 3. 3 pieces of this that were really important were, can you keep an individual mandate? Can you compel somebody to buy something? However, our take would be that their inaction, and I think Kim can talk more about this, about really what the hidden tax looks like, is actually a purchase that we're all making across the board. So our take would be that the individual mandate should stay intact. It keeps the guaranteed issue piece in place, which is one of the more popular provisions of the Act, so that people, regardless of if you got diagnosed with high blood pressure once, even though you've brought it back down, that you could get rejected from a health plan for that. So creating a bigger pool and having everybody go in together makes it easier to buy. However, it tends to be one of the more unpopular pieces. So, you know, my opinion would be that pieces of the Act could stay intact if you took the individual mandate out. I think another big question that the justices are answering is how much of their judicial authority can they use to displace the action of Congress and the unique action of checks and balances within our system. The other piece of this was that many states felt as if they were being compelled to provide more Medicaid services, so the low-income population piece of it that we're very excited about in California. And then the last piece of this, what they call severability, is if you take one piece of this out, how much can stand? So, you know, taking any one of those pieces out, in particular the mandate, makes it a much more dicier proposition. However, we've heard will in California from our leaders in the legislature and from our Secretary of Health and Human Services and from our Health Benefits Exchange Board that regardless of what happens, we're on the road to reform and we're going to figure something out. So I think that the will in this room needs to be strong. Call your congressional members, call your state legislators, let them know that you support Obamacare. It's okay, we're taking that word back, we can call it that. And that we're going to do health reform.
Thank you, Vanessa. I'm going to take that question to President Obama's regional director for California and the whole Western region is here. So if you had any doubt that both has a riot, Kurt Schultz is in the house. I'm going to put him on the spot. What happens if your president's health plan goes down with the Supreme Court?
Thank you, Dave. Hello, everyone. Hello, Kimberly. First of all, I think we should give everyone a round of applause. I knew in myself, I knew when I left the Schwarzenegger administration to join the Obama administration that Kimberly would end up serving on the board, and I think she's been an extraordinary member, and I want to thank her very directly for everything she's done. Daniel, we can talk about just keep giving that money. Bring it down. Anyway, I'll answer it this way. I'll tell you what the Obama administration is saying. One is that we are completely confident that the law is going to be upheld. Two, I can tell you that when Secretary Sebelius, when the President says there is no contingency plan, there is no contingency plan within this administration. We believe quite strongly that the law is going to be upheld, and what we're doing every day, and I had an opportunity with the Leadership Institute folks from last night. Who was there last night? All of you. An opportunity to talk a little bit about it last night, and what we do in the Department of Health and Human Services every day as I think you're doing in your communities, is getting out and really making sure that everybody understands that health reform is not January 1, 2014, that we are deeply into the implementation of health reform. It means real benefits for real people, and that's what we focus on day to day to make sure that people understand their benefits, responsibilities, people with pre-existing conditions, seniors and people with disabilities who have hit, dramatic drug costs, 2.5 million young adults, and that's what we're doing every day. So no contingency plan, and we are very confident the law is going to get upheld. So thank you.
There's a question over there in the middle.
My name is Fernanda Karp. I come from San Jose. I work at San Jose State University in the area of student affairs. And the question is, what kind of well, as you all know, students are actually paying more for tuition and they are squeezed because of the lack of resources, and some of our students actually have experience going out without food for days. And so there is a hunger issue on campus, and I am sure of several of the campuses, students are experiencing the same situation. So my question is, what kind of outreach have you done to that population? And the second part of my question, because I work in student affairs, is we're exploring ways of collaborating with other organizations to support our students, and what kind of support of partnerships you would recommend for people who work in student affairs or work in a university or community colleges to support those students. Thanks.
You touch upon a population that's a perfect example of the point I was making earlier, which is we have a lot of work to do now so that when 2014 comes, we're not starting from scratch, but we are immediately transitioning what I would hope to be well over 1 million people into either expanded coverage through Medi-Cal or tax credits with the exchange. Young adults whose parents don't have access to coverage, who are uninsured, is a terrific example of a population that come 2014 will be eligible, either as low-income single adults through the expanded Medi-Cal program, or they'd be eligible for tax credits through the exchange, depending upon where their income falls. That won't take effect until January 1, 2014, unfortunately. But now's the time where we can be working with you to identify those populations we anticipate to be eligible and kind of do pre-enrollment, which is frankly one of the strategies we're talking about. Also, in the near term, as I noted, many of our counties, including in the Bay Area, have what are called low-income health programs, or LIFs. This is part of something called the Medi-Cal Bridge to Reform Waiver, again, a bunch of jargon, but it's a part of an effort the legislature and the administration, the Schwarzenegger administration and now the Brown administration, have supported to basically do some early investments in reform. So if low-income single adults, including students, would be eligible for these low-income health plans, LIFs. So I encourage you to reach out to your county health departments to find out about whether or not there's a near-term fit. But also, you can be expecting to be hearing from the exchange as we move forward with developing our outreach and enrollment effort, because we would look at the community colleges and CSU as very, very important partners in that effort between now and then.
Okay, we have a question here from Napa Valley.
Hi, my name is Maria Villagomez. I'm here with the Napa Valley Group. I have a question for the panelists. This is not a question from me. I am representing someone who asked me to ask this on their behalf. So I hope that you don't ask me to elaborate on the question, because I'm having difficulty understanding the question myself. So here it goes. It says, do any of the organizations represented on the panel support or advocate for a single-payer healthcare system, also known as public healthcare, as an alternative to our current system, and why or why not?
Vanessa?
As I work for the advocacy organization, yes, Western Center has been supportive of single-payer for the past several years, since Senator Kuehl started to introduce it some years ago. And we tend to think of it as a Medicare for all in terms of there being a single pass-through to delegation to providers. Now, yes, it would significantly change the way that we deliver healthcare in California, but as a means of being able to cover everybody with equitable coverage and maintain one single system. You know, I can say in terms of advocating on behalf of the Medi-Cal program, I have a point every day where I think to myself, this is so darn complicated. I wish that I just had one thing to go to. However, I think that we're also cognizant of the political climate, which is a difficult place for this to get to, and is, I would say, the outreach has not been given a language that a lot of people can really adhere to on what single payer really means. And, you know, also a lot of people are very satisfied with their current health plans, and it could change under that. But in terms of covering everyone equitably, Western Center has supported single payer historically.
Sonia, any thoughts from the Silicon Valley Coalition about single payer, where that stands now, especially with Obamacare hanging in the balance? Is there talk about that being Plan B out there?
No, we haven't necessarily gotten into that level of depth with regards to healthcare reform. So we are definitely engaged in this individual action and education and awareness. So I really can't speak to that particular issue at this point.
Fair enough. We have a question here from Salinas.
Hi everybody, my name is Karina Curiel. I'm here representing California Teachers Association. I'm a third grade teacher. And my question to you is, what coalition do you guys have with teachers with school districts? Because as we know, our students, they learn from an early age, so we're talking about healthy communities. Our kids are learning from their parents. So what type of classes do you provide for parents? What type of support do you give school districts? That's my question. Thank you.
I'll take an initial crack at that, and the comments are touching upon some of the key life transitions, if you will, or the points in people's lives that the Exchange is eager to learn more about, that gives us an opportunity to identify families who may be eligible for coverage. So a terrific example are kids. We cover through the Healthy Families Program and our county health initiatives and Medi-Cal. We do a pretty good job with kids. We still have too many who are eligible but unenrolled, but we've done pretty darn well. The kids of Healthy Families, or the parents of Healthy Families kids, a good percentage of those parents are not insured. So there's an entry point through the children to identify parents and get them connected to either Medi-Cal or tax credits through the Exchange. So as a part of the work that the Exchange is just beginning, and as was noted, we were in Fresno last month, we dedicated our entire meeting to talk about outreach and education and enrollment strategy. We're identifying where are those coalition partners that we need to be bringing into this effort. It will be a campaign, it will be a multifaceted campaign and a sustained campaign, and schools are critical partners. We've learned that in the past, and we know they're going to be partners as a part of the Exchange and Medi-Cal expansion.
So good. Thank you, Kim. We have a question back here from Modesto.
Good afternoon. My name is Maggie Mejia, and I'm from Modesto. And my question to you is, what is the percentage of Latinos that are on CalFresh Medi-Cal in the Central Valley compared to the entire state of California?
Okay, they're looking at me. Sounds like a good research project. I do not know the answer to that question off the top of my head, but I will say this. One, I do know, because we had a briefing on this at our last Exchange meeting, board meeting in Fresno, is we looked at the profile of the people who are eligible for the Medi-Cal expansion and people who are eligible for tax credits through the Exchange, subsidized coverage. You know, these are the millions of people we collectively need to get connected to coverage come 2014. We looked at, based upon a variety of assumptions made by super smarty pants research types, we make good progress, a couple million people newly enrolled in Medi-Cal, a couple million newly enrolled through tax credits in the Exchange. But still, a couple of million, 3 million people will remain eligible but uninsured. Now, some of those are because they're undocumented immigrants, but 2/3 are eligible and indeed going to be required to buy insurance. Roughly half of all of those people who remain eligible but unenrolled are Latinos. Now, we don't have the sub-geographic breakouts yet. That's our next iteration of work. But you put your finger on such an important issue. People are eligible today and will be a larger group eligible come 2014. We have to connect them to services for which they're eligible. And that is not going to be just an exchange responsibility, it's really a shared responsibility to achieve our mutual aspiration.
Okay, we have one last question from Fresno. I know I have a lot of hands, but we're going to have to wrap it up in a minute, so there you go.
Thank you. Buenas tardes, good evening, good afternoon. My name is Lourdes. I work as a producer for Radio Bilingüe, the National Latino Public Radio Network, and also HLI 2004. I would say to all of our communities represented here, you have to get the data that the youth presented, because it's very, you could say, grassroots and real data on the healthcare and education. Secondly, as a Latina, my question for the Health Exchange Board is, as a consumer, what should I be expecting? Because even if it's going to be a web-based or however it is you're going to present it to us, I have to think about my community who might not have access to have a web-based exchange board. And it also, as a consumer, what should I expect from those companies to give back to my community? Because after all, we are kind of through the healthcare, giving them access to a pretty targeted population.
Yeah, it's such a good question, and I think one of the things we are most hopeful about in terms of the federal reforms is that this vision of no wrong door. It's the idea that people can get connected to coverage through community organizations, through call centers, through technology, if someone has access to and wants to use the internet, through the mail. So this idea of multiple pathways to coverage. The internet is going to work for some people, but for a lot of people it is not. And so the vision is that there will be a significant investment in community resources and robust multilingual call centers to help people meet people where they are in terms of their educational, cultural, linguistic needs, providing them with information about insurance, about what their options are. We are going to be bringing together a cadre of what are called navigators or assisters throughout our communities, and from and of and by and for our communities to support this effort going forward. So we are doing something we haven't done a lot of in government, and that is putting the customer at the forefront of what we do and really trying to create a first-class customer services that accommodates the diversity of needs of the people that we are slated to serve. So you all need to be a part of that, and you need to help us make it right, because we will not be successful in expanding coverage, expanding access, and improving health, not just of individuals, but broader communities, if we can't get people connected to services that matter to them. Thank you.
Thank you, Kim. Irene, any final thoughts on that question or other subjects, all the important issues that have been raised today before we close?
She is so eloquent. She's done a beautiful job. I think for us, it's preparing every day for the entry of many others who don't have coverage today, and making sure that we don't become a barrier to that access. So we have lots of activities going on in preparation and anticipation. So very glad to partner. Thank you.
Sonia, any final thoughts?
Well, as a Latina and part of the Latina Coalition, we really are happy to see the work that's been happening in our community on the countywide and citywide level that's already ongoing, and we're really looking forward to continuing what we've done through our social media project, expanding and or partnering up with some of the organizations locally to increase that individual education and awareness around healthy eating, active living.
Great. Vanessa?
Just that we still have a lot of work to do ahead of us. We still have to figure out, what the kinds of health plans are going to look like in the exchange. We have to keep fighting to keep health reform throughout the United States, just in California. And I will wrap with the words of a very wise lobbyist who once told me, you only lose when you give up. So we might be pushing rocks uphill for years, but we're not Sisyphus. We'll get there. But it takes everybody in this room, and you telling everybody in this room, just like you have your voting charge right now, to keep active and never say no.
Great final word. Thank you, Vanessa. Thank you, Vanessa, Ken, Irene, Sonia. Thanks for that. We're going to close with one last 60-second, another product for changing people's views about health. And one of the things I think I can say for all of us is we're so thrilled that this group of leaders and future leaders, when we had a conversation about health, the basics of health came up. Not just healthcare delivery, but also you talked about food, you talked about schools, you talked about those things. And this last 60-second message will give you a tool that you can all get from the endowment that helps reinforce that. Thank you again for participating.
Can prevent heart disease. A grocery store can stop diabetes. Did you know how long you live depends on where you live? Children born in neighborhoods with safe parks, fresh produce, and clean drinking water can live up to 20 years longer than those born in places without them. We can do better. We have the power to give every child a longer, healthier life, to build a stronger California. We can change the places where we live, work, and play. Because health doesn't only happen in the doctor's office. Health happens here.